Hi there, I'm Dr. Martin Benfield. I'm a GP trainer, and this video aims to demonstrate some of the skills we talked about in the last two videos, the explaining conditions and how to make them more interactive. And I'm going to use heart failure as an example. So I'm going to give an example of heart failure, hopefully demonstrate some of the skills we talked about in the explaining conditions, and then I'm going to do the same thing again, but add in patient-specific information and to try and make it more interactive. With my generic explanation, I'm going to start by categorizing what we're going to cover. Then I'm going to give a simple explanation of the pathology, why it might have developed and what's like to happen without treatment. We're going to look at a treatment plan, including how that will happen and important side effects. We will look at a non-medical treatment. I'm going to give a safety net for worsening symptoms, and I'm going to finish with a summary and a check on the important information I want the patient to remember. It will not be perfect. I expect lots of you will do it in a slightly different way, and this is really to demonstrate the consultation skills rather than being a nationally accredited way to describe heart failure, and it's not going to necessarily follow exactly NICE guidance, for example. There is more information I could add, but remember there is a balance with also optimizing understanding and recall. So for example, in the explanation I'm going to start the person on ramipril, but I'm not going to mention a dry cough because I felt like I'd already given enough information for the patient to be maybe saturating how much they're able to take in. It's not a life-threatening side effect, and I will be reviewing the patient where I can cover things like that later on. If starting ramipril was the only thing I was doing today, then I would certainly be mentioning a dry cough in that explanation. So here we go. From the symptoms and the examination and the blood tests, it looks like the symptoms you've developed are due to the heart. What I would like to do is explain how that might have come about, what's happening, and the sort of treatment we might be able to do for it. If a person's heart isn't pumping as hard as it used to, not as much blood gets through the kidneys and out to the muscles, and also it doesn't suck as much blood out from the legs and out from the lungs, and that can cause things like leg swelling and breathing symptoms. Because the heart is failing to pump as hard as it used to, the condition is called heart failure. There are lots of potential reasons why this could develop, including high blood pressure for long periods in the past, and any heart muscle damage that might have happened in the past. Without treatment, the symptoms might gradually worsen over years, but if there's still heart damage occurring, it could worsen a lot quicker. So for that reason, what I'd like to do is refer you to a specific heart clinic at the hospital, and what they will do is they will look to see if there's any causes that they can do something about, and to make sure you're on the best medications for this condition. I'll send a referral. They will contact you directly and expect to hear from them within 2 weeks. I would also like to start you on two new medications today that should start to improve your symptoms. One is a blood pressure tablet called ramipril that also improves how well the heart and the kidneys work. And the other is a tablet that removes excess fluid from the body, and that's called furosemide. Because it removes water, you will notice that you're having to pass urine a bit more, particularly for a few hours after you take it. They both reduce blood pressure, so it's important you let me know if you start feeling lightheaded when you stand up. And the final thing we need to arrange is a kidney blood test to check the kidneys are okay with the new medications. I'll do a form, you just need to book the appointment for next week. I would probably just take it easy for the next few weeks until the hospital finish their treatments. You can do the things you normally do, but don't do any new exercise activities until they've completed their tests. When they've completed their tests, probably one of the really important treatments will be actually you getting a bit fitter again. If you develop any worsening symptoms or anything unexpected, please let me know as soon as you can. So if you could go to the pharmacy to pick up the new medications tomorrow, let me know if you have any problems with it. Book yourself in for that blood test next week and expect to hear from the hospital clinic within 2 weeks. Then I can see you again when they've finished all their things. Okay? So there we go. That's the sort of generic monologue version. What I'm going to do is repeat this again and try to make it more interactive using techniques from the last video. And this includes adding in information that I've gained from the history that make it more relevant for the patient, and try to make it more of a discussion using checking questions after chunks and then adapting the speech dependent on the answers. Okay, so here we go. So you wondered if your symptoms were due to the heart or the lungs. Now, based on the symptoms, the examination and the blood test, it looks like it's your heart that's causing those symptoms. What I would like to do is explain what the condition is, how that might have come about, and the sort of treatments we're going to be looking to do. If a patient's heart doesn't pump as hard as it used to, not as much blood gets through the kidneys and out to the muscles, and also it doesn't suck as much blood up from the legs and from out of the lungs, and that's what causes the leg swelling you've noticed and the worsening breathing symptoms were recently. Does that make sense? Because the heart is failing to pump as good as it should do, the condition is called heart failure. Have you ever heard of that before? Really? Your mum had it? Okay. What do you remember about your mum having this? After she had a heart attack? Yeah, that makes sense. And do you remember any treatments she had for it? Yeah, several, but you remember definitely she had a tablet to get rid of the fluid from her legs. We're actually going to talk about that in a minute. There are several potential reasons why you might have developed this. Now, heart damage from something like a heart attack before is a common reason, and it is possible to have heart damage without the person really knowing about it. Now, you said you'd never had any chest pains or unexplained events that might have been angina. Is that right? Uncontrolled high blood pressure is another contributing possible cause. Now, looking back at the reasons for you over the last few years, looks like yours have been reasonable from what I can see. Yeah, okay. I could go into a lot more medical details. Is there anything else you wanted to ask before we move on to treatments? Okay. Well, without treatment, the symptoms might worsen very gradually over years, but if there's still some heart damage occurring, it could worsen a lot quicker. So for that reason, I'd like to refer you to a specific heart clinic at the hospital. And what they will do is they will look for any evidence of causes for this that might still be going on. So things like silent angina that might be happening without you realising it. They will also make sure you're on the best medications for this condition. I'll send the referral. They will contact you directly and expect that to be within 2 weeks. Would that be okay? Great. How would you get to the hospital? Oh, okay, that's fine then. Fine. I would also like to start you on 2 new medications that should start improving some of those symptoms you're getting. One is a blood pressure tablet called Ramipril that helps the heart and the kidneys work better. The other is the water tablet like what your mum had, and it helps remove excess water from the body. It's called furosemide. Does that name ring a bell? I think it was the same. Do you remember her having any problems? Yeah, absolutely, yeah. So because it's removing excess water from the body, you are going to have to pass urine a bit more, particularly for a few hours after taking it. Do you think that might cause you a problem? Okay, well, if you are going out in the morning and there might not be an obvious place to go to the toilet, just don't take it in the morning. You can take it when you get back later. Yeah, that's fine. That's fine. Final thing we need to do is arrange a blood test to check your kidneys are okay with the new medications, and I'd like you to do that next week. I will do a form, so you just need to book the appointment. How did you book the last blood test? Great, great. And are you okay doing that again? Wonderful. Okay. I would suggest taking it easy for the next couple of weeks until the hospital have completed their tests. You can do your normal things, just don't do any new activity. However, after the hospital have completed all their tests, one of the really important treatments is going to be about you getting fitter. What sort of exercise do you think you'd be able to do once those tests are done? Walking would be great, and we can talk about that a bit more after all their tests are done. If you develop any worsening symptoms or anything unexpected happens, please let me know as soon as you can. Have you ever had to call 111 for anything before? Great. Okay, well, obviously, if you get anything that you think can't wait and we're shut, call 111 like you did before. Okay. When do you think you'll be able to get to the pharmacy to pick up the medications? Yeah, tomorrow would be fine, absolutely. Will you let me know if you have any problems? Great. We covered a lot there. So just checking you remember when you're going to go and get that blood test done. Yeah, absolutely, next week. And when are you expecting to hear from the hospital? Within 2 weeks. Great. Okay. Do you have any questions about all that? Okay. I will call you if there's any problems from the blood test. And you're going to call me if you get any issues with the medications or anything unexpected happens. And then we can meet up again after the hospital have finished all their treatments. Okay. So hopefully you spotted all the interactions, all the questions there. You can rewatch the video and make a note of those questions if you wanted to. What I would advise is whenever you're revising a topic, make how you're going to explain that condition part of that revision. And with AKT in mind, if you're still going for AKT, is if there are facts that you think you might forget, by all means see if you can build that into your usual explanation to increase the chance you're going to remember it. If you start saying that out aloud to patients, you're going to remember this in the exam. So do what I did, start your explanation and then read through it and out loud to see if it makes sense, and then start adding in questions that you could use. Now, you will find this gets easier and easier because the sort of questions you're going to be putting in are going to be the same a lot of the time. So things like, oh, how will you get to the hospital? And when do you think you can pick up your medications? In the actual consultations, while you're still data gathering, start logging in symptoms, risk factors, ICE answers that you're going to then add into your standard explanation to make it interactive. Okay, good luck.